it's scary. Like how many women come to me that are on an antidepressant, that are on anxiety medications, and it's their hormones. So I'm lucky I said no to all my doctors. So most women will see 6 providers before they actually get a diagnosis. I saw 5.
Health and wellness is confusing. There's a new trend every week. Everyone's got an opinion, and half the time you can't tell what's legit and what's just good marketing. And we get it. We're in it too. Welcome to Dialed In Health. I'm Melissa Goodwin. Every episode, we bring in the people who actually do this work. Providers, practitioners, the experts who see clients and patients every day. We ask the questions you'd ask if you were sitting across from them so you can find the right people, make better decisions, and feel confident about what's out there. Whether it's peptides, gut health, water quality, ADHD, biohacking, or something you've never heard of, we're covering it. So let's get into it. Let's get dialed in. Hormones drive nearly every system in our body, and when they get out of balance, everything suffers. And yet most of us don't really know if our hormones are in balance or if they're out of balance. It might be causing things like fatigue or mood disorders, swings, weight gain, brain fog, all kinds of things that are underneath the hormone imbalance. So today we are here at Encompass Wellness and Aesthetics talking to Mary Jordan.
Hi, Melissa.
Nice, a nurse practitioner and a former ICU nurse.
Yes.
So welcome to the show, Mary.
Thank you.
So great to have you here. We're going to be talking specifically about hormones today. You do hormones and some other things as well. So tell us a little bit about what Encompass Wellness and Aesthetics does.
So we are a wellness center here in Sioux Falls, and we have a location in Dakota Dunes, but we specialize in hormone replacement. We also do GLP-1s. Love my GLP-1s. I lost 50 pounds on it.
Oh my gosh.
But then once you feel better, you start wanting to look better. So we got into aesthetics. So I've been doing Botox and filler. We have our BBL machine. We have our Morpheus 8. So we also do a lot of thyroid management, hypothyroidism right here. So we do a lot of thyroid management because we treat the whole patient. So we make you feel good and look good. So
that's amazing. Yeah. So tell us a little bit about your story. What brought you into treating patients and into this whole world of hormones and hormone replacement therapy?
Yeah, I've seen behind the curtain, working in the hospital for 12 years at St. Luke's in Sioux City, and I worked oncology surgery for 7.5 and in ICU for 5 years, and seeing all the chronic issues that come as we age, especially doing like CRT, it's 24-hour dialysis, continued renal replacement. You're really focusing on labs and watching labs, because if they get off, if your sodium gets low, your brain swells. If your potassium gets high or low, you're going to go into a life-threatening arrhythmia. So really saw how important having your electrolytes are in line, and it's the same thing with hormones. You really feel it when they get low. All the side effects that come with not having your hormones in line, and that's what really drove me into my passion, because working at a 6-figure job, I was happy where I was, but when I learned about hormones and got my hormones, that was it. I started my own clinic, and that is our main focus, is to get women back their missing hormone. We see a lot of women that come to us that are on just estrogen, or some don't even get started on progesterone or a lower dose of progesterone, but the missing hormone, testosterone, we lose it first.
So tell me a little bit about that. What might a woman experience if your hormones are out of balance? And we'll talk about testosterone in a second. But what might be some symptoms that, like, hey, I should get my hormones checked?
Oh, gosh. The main thing I will see is the vaginal bleeding.
Okay.
Your cycle gets heavy. Some people it gets lighter. It comes early. It comes late. And a lot of people will be like, oh, I'm starting menopause. But really, you're starting andropause. You're losing your testosterone. You'll start having headaches. Anxiety gets worse. Heart palpitations, joint and muscle pain. Your testosterone is a natural anti-inflammatory. Okay. So we need our testosterone. So when you lose testosterone, that's when you start losing muscle too. So when you lose your muscle, then you lose all that metabolism. So you start gaining body fat. So it gets really hard to lose the belly fat, is what mainly women will come in and be like, I work out 6 days a week. I can't get this belly gone.
So you mentioned a word, andropause.
Yes.
I've never heard that word before. What is andropause?
Yep. It's the loss of testosterone. We use it a lot for men. They don't use it for women because there is no FDA-approved testosterone for women. Although that's the main thing we lose. We start losing it in 30s. All as humans, we peak in our 20s. Then we start losing our hormones in our 30s. And that's when you start to feel like, oh, I slept wrong. My back hurts. It's like,
Yes.
no, honey,
Yes.
that's your testosterone talking to you. It's low. That's what you're feeling is those joint and muscle pains. That is your testosterone. That is the first sign.
So you have low testosterone, or how, why do I need testosterone as a hormone replacement then? Is that usually the first one that I need?
Yep. So we'll do
Okay.
a whole comprehensive lab panel. Our consults are 90 minutes. So we sit down and explain each lab to you. So you
Okay.
understand why we're treating you this way and what is out of whack. And so testosterone, we do 3 different ways. We can do pellets, injections, or creams.
Okay.
I prefer the pellets. They're bioidentical. But us women, we have 3 times more testosterone in us than we do estrogen and progesterone. So you really need your testosterone. That is what really gets you feeling better, gets your energy back. Because people will eat and be like, oh, I fall asleep or I'm tired after I eat. Or 3 o'clock,
Right.
you're hitting a wall and you're reaching for caffeine. 5 o'clock, you're off work and you're like, I'm ready to go home, go to bed.
Yeah.
That is your testosterone.
So my 3 o'clock coffee, that could be a signal. I mean,
yeah.
I drink coffee all like an entire pot, and then I get to a point where I get overdosed on caffeine. I have to go to green tea, and I get so sad. But I'm curious on the testosterone side. One of the things that we worry about is if somebody says you need testosterone, like, am I going to get like facial hair or
Yeah.
like what's going to happen if I start taking testosterone?
Yeah, I get that asked a lot as women think they're going to grow a beard. I've been on testosterone 6 years now. No beard. It's
Yeah.
not going to happen.
Okay.
I've had other providers say, oh, my OB told me I'm going to grow a penis by doing testosterone. Honey, if I could grow penises here, there'd be a line out that door. Like, it's not going to happen. We keep you at levels that are where women should be, where you're optimal in your 20s. So my oldest woman, she's 84, and I can tell you she does not have a penis. She does not have a beard. So.
Well, I have a little bit of a beard, and it's coming in a little bit as I get older, like the little hairs.
Even my grandma, she never did hormone replacement. She's 93, had a full-on mustache. Like, it doesn't matter. You're going to get it as you age. The facial hair just comes. I don't know why. I wish I could explain, but we offer laser hair removal.
Okay, so
yeah, we can zap it off. Like,
That's amazing.
the least of our worries, because when you lose your hormones, you're slowly opening that door to chronic health issues, which is
Right.
all the health issues I saw when I was in the hospital. And I'm like, there's got to be a better way. Like, I did not want to get old.
Yeah.
Just because of everything I saw in the hospital. I'm like, oh my gosh, like, I'm going to hit retirement and then
We're gonna fall
you're
apart.
you're going to get cancer. You're going to need a hip replacement. And most people who have a hip, fall and break a hip, you do not make it back home. Most people end up either passed away from throwing a blood clot or they're in a rehabilitation center and never get back home. So I was like, gosh, the outlook after 65 is not pretty. But if you can get your hormones in line, and you want to get them looked at in your 30s, get a baseline.
Okay.
Because 10 years before hitting perimenopause, I don't like to call it menopause, you should be getting your hormones going. Because that is going to keep that door shut to chronic health issues. You don't want it open.
Quick break. This episode is brought to you by Vitality Growth Labs. If you're a health or wellness practice and you're wondering why your phone isn't ringing the way it should be, Vitality Growth Labs builds the systems to fix that. Get found, build trust, fill your calendar. AI authority stacking, videos that connect with your clients, real tools, strategy, and execution that results in real revenue. Visit vitalitygrowthlabs.com or check the provider directory at vitalitygrowthlabs.com/the directory to find a trusted wellness provider near you. All right, back to the show.
What is andropause, perimenopause, menopause? Like, when do these things happen? How does this all work?
Yeah, the classifications I feel like are not even classified. They're calling it pre, peri, and menopause.
Okay.
I call it andropause, perimenopause, and menopause because we lose our testosterone just like men. That is andropause. And then we go into perimenopause, which is the loss of your estrogen and progesterone. And it's so gradual. You will live 10 to 15 years in perimenopause. So that's when you start having difficulty sleeping, vaginal dryness,
night sweats,
hot flashes. That is perimenopause. Menopause is classified as a year of no cycle.
Okay.
So you're kind of out there after that. So, but your hormones are so important for your health because chronic health issues start because of inflammation. It's the root of all evil. It causes, the metabolic disorders that we get as we age. There's so many health issues we can prevent. by a simple blood draw.
Before we go into talking a little bit about men, tell me how the bioidentical hormones help prevent some of the things that you saw in the ICU.
Yeah, so bioidentical hormones, they're going to help so you don't get dementia and Alzheimer's. So the confusion, you don't remember to drink your water, you don't take your meds right, just all those issues. And then also with women, we get urinary tract infections, recurrent urinary tract infections, because you're losing those hormones and the strength in that sphincter starts letting bacteria up there.
Okay.
So recurrent, I see urosepsis all the time in the ICU. And it's really sad that it's that preventable. So, I mean, you can do your hormones bioidentical. So bioidentical means it's identical to what your body makes. So it identifies that as its own. But yeah, just the sepsis, the dementia, it's cardiovascular protective. Oh my gosh, like 1 in 6 women will die of a heart attack. And your first symptom of a heart attack is death. Like you will die from that heart attack. 40% do. That's scary statistics. It's a simple blood draw.
Yeah.
Just getting your hormones checked. It's just, because I started having heart palpitations at 38, and that is when they sent me to cardiology. I wore a Holter monitor for a week. They were like, oh, you're having PVCs, PAVCs. Everybody gets them. You're going to live. It's not life-threatening. But then I was like, but why am I having these? Why is my cycle heavy? Why am I having heart palpitations? And all they said is, oh, you probably have anxiety. We can give you a pill for that. I didn't want a pill and feeling tired all the time. I went to my PCP and they were like, oh, yeah, you probably just have depression. We can give you this pill for that.
Right.
So many women are misdiagnosed.
Right.
It's scary. Like how many women come to me that are on an antidepressant, that are on anxiety medications, and it's their hormones. So I'm lucky I said no to all my doctors. So most women will see 6 providers before they actually get a diagnosis. I saw 5.
What's so crazy is, I remember in my early 40s, I started what I thought was panic attacks. Like my heart would race.
Yeah.
And I thought, well, maybe it must be my high pressure job, or like, and my partner would say, like, you seem like you're tired all the time. Well, it must be my job. It must be that I have kids. And no one ever suggested, maybe you should have your hormones checked.
Yeah.
And so if you're out there and you feel any of those things, and if you're late 30s or 40s and maybe what you thought was anxiety or thought was, just a lot of high pressure stuff.
Yeah.
Maybe get your hormones checked.
Yeah, because I have 4 kids. I was a nurse working night shift at the hospital, and I was like, oh, maybe it's my job.
Right.
I'm just getting older, and I have to live like this. It's kind of how the doctors made me feel.
Right.
It's like, this is normal. You're probably just need a pill for that. And you just need a simple blood test. And just finding the right provider is really important, too. Because some people will want to give you more pills, but doing patches and creams are fine. There are some creams that are bioidentical, but 40% of women don't absorb them. So I see a lot of women on the creams or the patches, and then they're like, oh yeah, I've been on this patch for 10 years. And I'm like, oh great, let's see what your labs look like. What was your last labs? And they're like, I haven't had labs done. Oh, and I'm just mind blown. I'm like, okay, how do you know you're getting the right dose to actually prevent the cardiovascular problems that are going to come?
Right.
Like they're not testing them too. So again, finding the right provider.
So how often should you get your hormones checked? How often, do you need to make sure that you're optimizing whatever your body is? Because you're going up and down in different, phases of life. I would imagine they change.
Yep. So I would say 30s, you should start getting your hormones checked with your annual physical. Because then you're going to catch it. You're going to see each year, okay, this has gotten worse. And then you'll start seeing, we have an assessment form we have you fill out. And I can tell you before I even look at the assessment form, looking at labs, I'm like, oh, she's got to be feeling like hell right now. And then I'll see the assessment form after she comes in and fills it out. And I'm like, oh, yeah, that's exactly how I thought she would be feeling. But yeah, at least annually in your 30s, but in your 40s, you're really feeling it. And then the lack of estrogen, it also makes you lose your a collagen elastin. So then we start having saggy skin, which is so sad that everybody that comes to me, they're like, oh, I'm taking collagen. Like, you didn't suddenly stop eating collagen. Like, you don't need more collagen. Your amino acids and your estrogen, that's what we need. It's the building blocks, like, for our skin, for collagen elastin. So, yeah, there's a lot of health benefits, not just for our bodies, but aesthetically too.
You mentioned a couple things that were interesting. So topical, I've seen ads for like topical estrogen creams, and like you said, collagen. Like, what is real? What do I need to be doing to make sure that my skin is looking as good as it possibly can, and that I'm getting the right form of the hormone?
Yeah. So bioidentical, I myself prefer the pellets. Consistency of getting it, because your pellets are going to absorb based off your heart rate. So the more you move and do, you'll activate those pellets and absorb them. The creams you have to put on every day, and you have to be careful you don't get them on pets or kids or scratch and get it on doorknob and give it to everybody. So the pellets are really nice because women, we just get them every 3 months. You just set them in. It goes into the sub-Q fat of your upper buttocks. They're tiny, like size of a grain of rice. They're so little. Okay. But your body absorbs them based off your heart rate. So consistency is key with getting your hormones, especially aesthetic-wise. So like I said, 40% of women don't absorb the creams. So doing creams and then just getting your labs checked every 6 weeks is really important to making sure they're actually working.
Well, let's talk about men a little bit. So you see men here too. What are some of the things that men come in to talk to you about? There's a lot of testosterone places that you can get testosterone.
Yes, men can go everywhere.
Yeah. So tell me, why do they come here? What kinds of issues do they have when they come to see you?
Well, it's funny that you say it, because I had a woman come in for her hormone consult and her husband sat in on it. And he was like blown away. He's like, how many labs did you check on her? I'm like, well, we did FSH, estradiol, SHGB. We did, I listed them all out. And he goes, they did these 3 labs on me. And I just went to that male clinic down the street. He goes, can I come here? Do you do men? I'm like, oh, absolutely, we can. Yeah. And I was really curious to see what labs they drew. So after I looked at it, I was like, it's basic labs just to get you started on testosterone. It's not really looking at thyroid function. Your vitamins, if their vitamin D is low, if vitamin B12 is low, your whole body needs to be balanced, just like I saw in the ICU. If you do not have everything in line, you're not going to feel the best. Your body's not going to function the way it needs to. So it was really interesting when he brought me that. I was like, oh my goodness. So that's what's happening over at the male clinics.
Yeah. So tell me, from that perspective, when men come to you, what are some of the things do you find that often they have high inflammation or other things too that you have to treat?
Yeah. Low vitamin D, and that puts you at higher risk of autoimmune disorders, cancers, osteoporosis as you age, thyroid disorders. We catch Hashimoto's, we catch Graves' disease, because we're doing the antibodies for your thyroid as well. Not just a TSH, not just a T4. You have to do a full thyroid panel. So we're catching those. But B12, it helps a lot with your neurological function, your energy, your metabolism. So we're checking a full panel. It's not just a total testosterone. You got to see a free testosterone. That is what's bioavailable. It's circulating in your blood. That's what's actually functioning. So a lot of the labs that are done there I saw were just basic. It was just, knocked my socks off.
I'm curious because you mentioned, I've never think about cortisol as a hormone because I always think of stress, cortisol, always spikes. Yeah. So do men have high cortisol as well? Do you find that men's stress levels are also high?
Women's are all mainly the ones that are off.
Okay.
Men, not so much, but I think because our testosterone, we have so little when we lose it.
Okay.
Because they have, oh my gosh, like 100 times more testosterone than we do.
Okay.
But also, we are the caretakers. So that's the other thing is I have a lot of women that come to me and then they bring their husbands. So they get feeling better. The husbands see them getting better and they're like, what is this you're doing? So then we get them going on the hormones too. Like, got to have your libidos match.
That's true. It doesn't work if one's working and the other isn't.
I've had women come back and say, you have to turn this down. My husband, he can't keep up with me. I'm like, oh, bring me your husband. I need to talk to him. Like, if he's telling you no, oh my.
That's amazing. So if you have some, if you've got mismatched libidos, another reason to get your hormones checked.
It's so funny because that was, as a primary care provider, many of my men's annual physicals, they were like, my wife doesn't want to sleep with me. So I do turn into like a sex therapist.
Yeah.
Which I don't mind. I mean, hormones are not just sex hormones. I mean, they are chemical messengers. Like, they have thousands of functions in our body. But having good relationships, I've had women tell me like, oh my gosh, after I got my hormones in line, I can't believe I left my husband. Like, they got divorced, and she's like, he's coming around doing the housework, like the yard work still, fixing the the leaf troughs and oh my gosh. And she's like, I can't believe I divorced him. And I'm just like, oh.
Oh, wow.
Yeah. I mean, your hormones do play a key role in your relationships. Like,
Yeah.
so.
Well, what's so crazy is you go to traditional medicine. They take your labs. You're like, oh, you have do you have a virus or a bacterial infection?
Yeah.
And then there's like, growing up, and I might be just in a certain phase, but growing up, like hormones were something you went through when you're young, and then when you're old.
Yeah.
Like you have this crazy period of hormones when you're 15 and 12, and then no one ever talks about it again until you go through perimenopause. At the time, it was menopause. Perimenopause is feels like it's a new word.
Yeah.
So just understanding that they have such an impact over your entire body.
Yeah.
And we've never really
health, your
tested or talked about that is crazy to me.
I know. And I love talking about hormones because it really did. It changed my life. Like, I would not be doing what I'm doing today. I would be at home sleeping because I was so tired. My testosterone number was 7.
Wow.
For women, it should be 80 to 150. Like, I was on E, and I felt like it, too. Like, I felt like death. Every morning, my knees hurt, headaches. I didn't realize how bad my headaches were until I got my hormones, and I was like, oh, my gosh, I was living like that. So, I mean, growing old, I did not look forward to it because I felt horrible. Like, what's the use of getting older if you're just going to feel like poo? Like, so once I got my hormones in line, I'm like, oh my gosh, I'm up at 4:30 in the morning. I'm going till 8, 9 o'clock at night. Like, my days are busy. I have energy, my focus and clarity. The brain fog was huge. When that lifted, oh my gosh. It was like somebody turned the lights on. It was amazing. Crazy. I was just like, wow. Like, sometimes at the hospital, I would chart at 8 a.m. and then at noon, I was looking at my noon chart and I was like, did I really chart that at 8 a.m.? Was my brain even on? Like, there was times you did things and you're like, was that really me?
Wow.
Yeah. So
game changer. Well, I want to do a little bit of a Mythbusters section with you if you're up for it.
Yeah, let's do it.
So the first one that I have a question around, or this, you can tell me if this is true or false. Mm-hmm. But if taking testosterone make a woman look like a man?
It will not.
Okay.
No, we do not get your levels. Like, men get up to 900. Again, women 80 to 150. We do not put you at a man's level.
Okay.
So, yeah.
Does hormone replacement therapy cause cancer?
It does not. The FDA lifted that black box warning because it was a horrible study done back in, 1990s, where all the women were taking off their hormones. So that was lifted in January. So it does not cause blood clots. It does not cause strokes, which is nice because now I have patients coming back to me that listened to their primaries and got off their hormones. And they're like, I saw that on the news and I couldn't wait to come back and see you and feel better again. So it does not cause cancer.
Can you adjust testosterone pellets?
Of course, yes. We always start with the lowest dose. You're going to get the lowest dose to get you to your numbers. And then if we need to go up, we go up. But we don't want the numbers going too high because then you can have oily skin, acne, might have some hair thinning. And then that tells me, because I ask you at every appointment, are you having any side effects? They say no, and their labs match how they feel. Then we keep the dose the same or step down, or they want more libido, we turn it up.
All right. Okay. Menopause happens typically in your 40s.
Your menopause happens in your 50s. You'll hit that. That's when you start having the hot flashes, night sweats. Perimenopause, again, that starts in your late 30s, early 40s. That's when you're starting to lose your estrogen, progesterone. But andropause, that's going to start in your early 30s.
That's so crazy.
Yeah.
If you eat well, you get enough vitamins and minerals.
No, I see iron deficiency. That's another lab we do. We check for iron deficiency. I see so many women that are iron deficient. You're just not getting enough nutrients from your food that we have to supplement because you have to eat more than your grandparents did to get enough iron in your diet. So cooking with cast iron skillet, that helps. That's amazing. But nobody will eat the beef liver I tell them to eat, nobody's going to eat the sardines. So we do have iron that has vitamin C already in the capsule because that helps with absorption. So that's what we recommend, but eating your higher iron foods, your leafy greens, your kale, your spinach, throw citrus on it. It helps it absorb. So your mandarin oranges. Got to get that in there to help absorb.
Good to know. Yes. Yeah, all of these things. So if you had a billboard and you wanted to let everybody know something about hormones, you know, what they need to know about their hormones, what would your billboard say if we were able to put that on the highway for you?
Oh my gosh, the missing hormone. You need your testosterone, men and women. Because, I mean, really, again, like I said, you're going to start seeing chronic health issues. Just want everybody that is my patient, I want to see them thriving. I want to empower them so that when they get to retirement, you're traveling. You're getting out there, enjoying your grandkids. I don't want them in a nursing home sitting there. Like, that is my biggest fear. I just want everybody healthy. And
Yeah.
that's what we achieve. We achieve here. If you know one of my patients, you'll know they're healthy. Yeah.
So where can someone get a hold of you? How do they find you? Where's your website and your locations?
Yes. Yep. I'm in Sioux Falls, South Dakota. I'm in Dakota Dunes, South Dakota. And then our website is encompass-wellness.com, or you can call us. We're at 605-740-0414.
Wonderful. So if you want to connect with Mary and her team, we'll put those links in the show notes below. And if you have any other questions, you can find them on all the social channels. I would imagine you're on Facebook and
Insta, yes.
all the places.
All
so
the
thank you so much for being on the show, Mary. Thanks for educating us around hormones and all the things we should be looking out for to make sure that we're living our healthiest lives.
Look at facts over fear. Yes.
All right. Thank you so much.
Thank you.
Hey, that's our show. If someone came to mind while you were listening to this, if you thought, hey, my sister needs to hear this, or I should send this to my mom, or my buddy would get a lot out of this, please share it with them. Just hit the share button and send it their way. You never know what one conversation, one episode, or one piece of information can do for someone who's been looking for answers. And if you haven't subscribed yet, please do it now. It takes 2 seconds, it's free, and it means you won't miss an episode. We've got incredible stuff coming up, and I don't want you to miss any of it. And if you're a health or wellness provider and you want to be on the show, we'd love to hear from you. There's a link in the show notes to get in touch. We're always looking for people doing interesting work who want to share what they know. And one last thing, I get asked all the time about the products and brands I actually use. So I've put together a list of sponsors and favorite products that have worked for me and my family. If you're curious, that link is in the show notes too. Thank you for being here. And I really mean that. I'm Melissa Goodwin. The line is open. See you next time.